Welcome back to Wally's Nursing Videos. In today's lecture, we'll be diving into the acute complications of diabetes, focusing on different degrees of insulin insufficiency and how they lead to morning hyperglycemia. We'll explore the dawn phenomenon, the Somogyi effect, and the impact of relative, mild to moderate, and profound insulin insufficiency on diabetic patients. Additionally, we'll go over the key assessment findings, diagnostics, and therapeutic interventions for managing these conditions effectively. Understanding insulin insufficiency and hyperglycemia. Insulin insufficiency refers to the body's inability to produce or utilize insulin effectively, leading to elevated glucose levels in the blood. This insufficiency can vary in degree. Relative insulin insufficiency. A partial deficiency where insulin levels are inadequate for controlling blood glucose under conditions of stress or during early morning hours. Mild to moderate insulin insufficiency. The body produces some insulin, but it is not enough to fully meet the body's needs, particularly after eating or during times of increased glucose production. Profound insulin insufficiency. A severe deficiency where the body's insulin production is significantly impaired, leading to dangerous spikes in glucose levels and the risk of ketoacidosis. The dawn phenomenon. The dawn phenomenon results from relative insulin insufficiency. It occurs in the early morning hours due to the natural rise in counter-regulatory hormones like growth hormone, cortisol, and catecholamines. These hormones lead to decreased insulin sensitivity, increased glucose production, and consequently morning hyperglycemia. This phenomenon is common in diabetic patients due to the body's inability to produce enough insulin to counterbalance these hormone surges. Assessment and diagnostic clues. Early morning rise in glucose levels without preceding hypoglycemia during the night. You may also detect urinary ketones, indicating that the body has switched to using fat for energy due to insulin insufficiency. Therapeutic interventions. Adjust the evening insulin dose or change the timing of insulin administration to combat the early morning rise in glucose. Consider encouraging evening physical activity to reduce insulin resistance. The Somogyi effect. The Somogyi effect differs from the dawn phenomenon as it involves profound insulin insufficiency. Here, hypoglycemia occurs during the night, often due to over-administration of insulin before bed. In response to low glucose levels, the body releases counter-regulatory hormones, which trigger a rebound hyperglycemia by morning. Assessment and diagnostic clues. Hypoglycemia at night, sometimes resulting in symptoms like night sweats, shaking, or disturbed sleep. Rebound hyperglycemia upon waking. Testing blood glucose at 3 a.m. is critical. Low levels suggest the Somogyi effect. Therapeutic interventions. Reduce the nighttime insulin dose or advise the patient to have a bedtime snack to prevent hypoglycemia. Encourage monitoring nighttime blood glucose levels to better tailor the insulin regimen. Mild to moderate insulin insufficiency and its impact. Mild to moderate insulin insufficiency typically occurs when the body is still able to produce some insulin, but not enough to meet the increased glucose demands in situations such as stress, illness, or after meals. In these cases, patients may not experience profound hypoglycemia, but will have persistent hyperglycemia if not adequately managed. Diagnostic findings. Patients may report polyuria, polydipsia, and fatigue due to chronic hyperglycemia. Blood tests may show consistently elevated fasting glucose levels and the presence of ketones in urine. Therapeutic interventions. Adjust insulin therapy to account for increased insulin needs during periods of stress or illness. Incorporate dietary management and exercise to help control glucose levels. Profound insulin insufficiency and ketoacidosis. In cases of profound insulin insufficiency, patients are at risk of developing diabetic ketoacidosis, DKA. This occurs when the body can no longer use glucose for energy due to an absolute insulin deficiency, leading to the breakdown of fats and the formation of ketones. Diagnostic findings: polyuria and polydipsia due to solute diuresis, dehydration and electrolyte imbalances, elevated ketone levels in the blood and urine, leading to acidosis and, in severe cases, CNS depression. Therapeutic interventions. Immediate insulin therapy and fluid replacement are essential to treat DKA. Monitor electrolytes closely, particularly potassium levels, as insulin therapy can cause shifts in electrolyte balance. Nursing role and management. Nurses are critical in the assessment, education, and management of diabetic patients experiencing insulin insufficiency. Assessment. Regular monitoring of blood glucose levels, especially during the early morning and nighttime hours. Patient education. Teach patients how to differentiate between the dawn phenomenon and Somogyi effect through glucose monitoring and symptom awareness. Intervention. Collaborate with healthcare providers to adjust insulin doses and ensure that patients understand the importance of following treatment regimens, especially during illness or stress. Understanding the differences between relative, mild to moderate, and profound insulin insufficiency is essential for managing acute diabetic complications like morning hyperglycemia and preventing ketoacidosis. Nurses play a key role in early detection and individualized treatment, ensuring better outcomes for patients. Thanks for tuning into Wally's nursing videos. Make sure to like, subscribe, and share this video with your fellow nurses. If you have any questions or need clarification, drop a comment below and I'll be happy to help. See you next time!